Hi, welcome to the Nursing Lab. Today we're going to be talking about medication orders. And you guys are pretty familiar with oral route medications. So I've got Tylenol as an example up here on the board. Tylenol, 650 milligrams, Q6 hours. Our 650 is our dose, and our Q6 hours is our frequency. And what becomes important about these things as we start moving into IV math is understanding that we need to give 650 milligrams, and that dose doesn't change when we put it, say you have to mix it in applesauce, and you have to mix it in a teaspoon of applesauce or the whole cup of applesauce. The doctor doesn't tell you the order of how much applesauce to mix it in. They just want you to get this dose in every 6 hours. All right? So that's why that's important to understand. Because when we go to IV math and IV medication orders, the order really stays pretty similar. Is we're going to put on some Zosyn, which is a common antibiotic that we use, 3.37 milligrams, and we're going to say we're giving it Q8 hours IV, right? So we have pretty much all the exact same parts as we have of that one. Here's our drug, Zosyn. Here's our dose, is at 3.375. And here is our frequency. Now, when it comes to IV medication, there's a few extra things that we need to know about. We need to know the volume that the medication is in and the rate at which the infusion is supposed to be. How fast do we want to give that medication? All right, this is what becomes really important. Doctors don't always know what the volume is that medications come in. So here's a 500 ml bag that this Zosyn could be mixed in. Here's a 100 ml bag that it could potentially be mixed in. Or here's a 10 ml syringe that it could be mixed in. The doctors don't care what it's mixed in. They just want it mixed in something because they want that dose of medication to be given. So what we have to know then is, okay, we've got Zosyn, and we're going to say it's mixed in the 100 ml bag. Okay, well, the next part we need to know is how fast are we supposed to be infusing that medication? And we're going to say from our clinical pharmacology book, or from our pharmacy, or from knowing that this is what this medication is, you'll be given a lot of resources. Use the one that your facility uses. We're going to say this goes in 30 minutes. So we want 3.375 milligrams to be infused in 30 minutes. Sometimes that'll be in the order, sometimes not, but rarely is the volume ever in the order. So we need to always make sure that we're checking what we're given. All right. Cool thing is we're not going to deal with a drip factor today. We have a pump, so we're super excited. We get to go in, program it on the pump. Our pumps are always set for 60 minutes, right? For an hour. We know we have 30 minutes and we have 100 mLs that needs to be given. So whatever I do to the bottom to get to 60, I do to the top. 30 to get to 60, I have to take it times 2. So I'm going to take 100 times 2 and get 200. So I'm going to be setting up my pump 200 mLs per hour to get that infusion in time. Please let me know if you have any other questions about medication orders. Please understand the difference between volume, rate, dose, and frequency, because that kind of can mess some people up as they're trying to think about how we are going to be giving these medications. Have a great day, and if you have any questions, please let me know.